Huizenga's district director. The simplest term and sake of time is I'm his primary person here in Michigan. He is in DC right now with votes. I expect to be in DC next week as well with votes. We know we did not put this together, but we want to make sure we're available to you to listen to your concerns and your comments and questions. We've heard the call for doing a town hall. Unfortunately, with congressional calendars, we kind of build them out in advance. So what we've done to basically do it sooner rather than later is doing telephone town halls on Tuesday, which is this sheet. I think there were sheets up front as well. If you want to participate in that, to give us your number so we can dial out to you, so you can be a part of it. A lot of folks have expressed that they want it to be more listening, so a lot of people can air grievances or their comments rather than a lot of talking on Bill's part, so I will relay that information to him. So my goal here is to allow you guys to provide your comments. I'm going to put them all together and make sure Bill sees those. And if you can do me a favor, is just state your name and what city you're from in the district so I can more accurately compile my notes. That would be appreciated. Other than that, the floor is yours. Who would like to start? And obviously we've got other groups coming in, so
yes.
There's a little nature of rushness. I'm trying not to rush you, but we want to make sure everyone is.
From Holland, Michigan.
Bernie?
Okay. For town hall meeting, was that February 25?
So you, I believe, are referring, so every year we do a snowmobile tour to tour the upper regions of our district.
Wait, is there we fit one more person in here?
Yeah.
Okay. I'll grab a chair. Don't worry.
Obviously, you can only do a snowmobile tour when there's snow, which is sometimes an issue.
Town hall.
And there will be a town hall, I believe, in the Baldwin area on that date, but we're working to find other dates to do one.
So you're looking to find dates in around here, Grand Rapids?
Yeah.
Baldwin's a long way.
Yeah,
Right, that one's kind of on the
Not
book,
central.
but it's just the nature of the calendar.
And another question for tonight is, Mr. Huizenga willing to? And my name is Karen Joseph.
Yeah.
Grand Rapids, I'm in Kentwood.
Kentwood? Okay, appreciate it.
I don't mean to interrupt people. We're just looking at the constituent left a green hat. Does anybody see a green hat on the floor in here? Are you the plus one?
I am the plus
Oh,
one,
right
but
here.
I just want to stand because he's just sensitive.
Yeah, get that.
No green hat. Sorry to interrupt. Thank you.
No.
No green hat. I'm sorry,
Sorry,
man.
Karen.
Yes, when he does schedule a town hall, I would like to request that he does have a big venue.
Okay.
You know, I think this election kind of woke up a lot of people like myself. And before, I was sort of asleep at the wheel. I'd read the news, but I didn't do much. And I really want to be engaged now, and I want to be at a town hall. And what happened with Mr. Amash, who's in our area, is that many people showed up and many were turned away. And he promised next time to get an even bigger venue. And I hope to see the same commitment from Mr. Huizenga.
Yeah.
He'll be looking for a
We
big
do
venue.
town halls, and I can tell you the last one we did, there was probably more staff than there were constituents. And obviously, there's more concern right now. We've done big ones, we've done small ones, and we have a sense that this will be a big one.
Okay, all right, so you'll plan accordingly
Yes, yeah.
then. Great.
And we'll make it something, yeah.
What's the timeline that you're thinking on the town hall?
So I mentioned earlier, we've heard the call to do something sooner rather than later, so we've got a telephone town hall that we're doing on Tuesday. We do have something in Baldwin, which we realize is not essential, but we are working on finding a time to do the town hall more centrally in the district.
What time on Tuesday? Is there
I
time
believe
for that?
because of the mechanics of the telephone town hall, I think there's 2 of them. I believe they're going to go out at 6 and at 7.
At night.
At night,
Okay.
yes.
I think a lot of people in this room are kind of groups that we're most concerned right now about for today, about healthcare.
Okay.
I'm Betsy Ryan, I'm from Holland.
Okay.
Myself, I've been that parent sitting across the deaths from a doctor, listening to a diagnosis you've never heard of. My husband and I were blessed. We have great health insurance. So our first concern was not how we were going to pay for it. Our concern was that we needed to save our child's life. Luckily, he's alive. He's doing well, working on his own. But I do not want any parent to ever be sitting across from a doctor and worried that they're not going to have enough money to provide life-saving options for their child.
Appreciate it.
And I have an email to you, I think it's to you, from about scheduling a meeting with providers.
Okay.
My husband is a family practice doctor.
I
Grand
think
Rapids.
sent yesterday.
Yeah, Karen Joseph.
Okay.
sent me. Yeah. Yep.
Haven't
And,
been able to get to emails in a while.
oh yeah, I'm sure you've been busy, and I don't expect. I just wanted to let you know, put a face with a name
Okay.
there, that, and also Alana.
There in West Olive. And I'm part of that physician group.
Okay.
Yeah, she's one of the physicians that wants to have a meeting with Mr. Huizenga.
Okay.
Well, and I would echo that there's a lot of concern in the disability community, that we're simply just given like the back seat to the table as far as healthcare reforms, especially when it comes to Medicaid. You know, and we have been organizing, but we still don't feel like we really have a voice in those conversations.
Okay. What's your name and what city?
Jessica Malinowski, Hudsonville. You know, we're particularly concerned about block grants that cut funding by 45% over 10 years. We're concerned about losing habilitated coverage mandated for the first time in the ACA. Habilitated coverage loopholes, the reason why insurance companies could discriminate against my 5-year-old. When an adult has a stroke, coverage is presumed if your policy has physical therapy. When your baby has a stroke, they say, oh, that's rehab. He never had those skills to walk, and I'm sorry, we're not going to help you clear to walk. And it can take a long time to get that disability diagnosis. And habilitated is the safety net that helps kids before they're, so far significantly behind that they can get an educational diagnosis, they can get Social Security disability income. It's so incredibly long, but in the life of a child, it shouldn't take 30% of their life to get it. It's too long. And I'm really just very gravely concerned that we are going to lose core benefits if they make those big cuts. Certainly there's a way to give states more control without slashing budget.
Appreciate that.
My name is Virginia Bloomberg from Whitehall. And on the Affordable Care Act issue, my brother was diagnosed the weekend that I got married with stage 4 very aggressive prostate cancer. He's a self-employed person. He was able to buy insurance beforehand under the Affordable Care Act. And if it is repealed and it is gone, he will in no way be able to afford his treatment. Absolutely no way. Pre-existing condition, yeah, I think stage 4 cancer is probably a pre-existing condition. He will not be able to get it anywhere else. And in order to keep him alive, it would bankrupt our entire family, the cost of these treatments.
Well, and then there's the additional concern, if the solution proposed is the high-risk pools, how do you guarantee that there's not going to be a wait list? That there are going to be people dying before they can get in?
Well, and we did have high-risk pools before in Michigan, and the premiums were so high that most people, even if they qualified for them, they could get coverage. Somebody would write them a policy, but they couldn't afford to actually pay for the policy. So that does not work. That does not give anybody health insurance.
I'm sorry, the name is?
Susan Fabrick, Fabrick, and I'm from Fruitport.
Thank you.
The other thing that I would like to add is that, health savings accounts and these high deductibles are not the answer either, because we don't have money to put into the health savings accounts.
It helps the people who already have money.
Right. It only helps people who can afford it. It doesn't make it affordable for people who need it the most.
Well, it's interesting because to me, the complaint I hear almost most often about the insurance on the exchange, we have bought on the exchange every year since it's existed, is that the deductibles are too high. I mean, the premiums, also a problem for people depending on where your subsidy is coming in. But that's what they don't like about the exchange. They're really not going to like just more of the same.
Anyone else?
Can I give my name?
Yeah.
Michelle Burley. I'm from Fruitland Township, Whitehall. 49461. Burley.
I just have a semantics issue I'll bring up just for fun.
Oh.
Please ask him to stop using that catchphrase of universal access, which is a meaningless term.
Who? Susan?
Everybody on the whole betterway.gov.
On healthcare? Because I
yes.
heard it both on healthcare and
Universal
education.
access is like, we have universal access to cruise ships in this country, and it
You
doesn't seem
choose
to
to
be
pay.
good if I can't afford the tickets to pay for it. Universal
Yes.
access sounds
food for
lovely, it sounds
healthcare.
like we're gonna get something, but it doesn't mean that.
Well, and another concern I have is that you hear some, I mean, there are many proposals for healthcare reform, but you hear proposals where they say, well, we're going to cut those expensive mandates that were driving up your premiums. And I'm not saying there's not some truth to that, because you have to pay money to get good coverage, but I'm worried about what are the actual repercussions if we say mental health care is no longer a covered benefit?
Right.
If we say we don't have lifetime caps anymore.
Or immunizations aren't
We
covered.
do.
Yeah. Certain things may not be covered in those plans, and that'll be the,
Well,
we'll be
I
signing
mean,
on to plans that they're not aware of.
I think of my son, you know, generally, once we hit our out-of-pocket max, I mean, it's kind of hard to keep track of numbers. So he's 5, and ever since he's been born, we're talking like 50 to 70 grand is what our insurance company pays every year. I mean, it just keeps going. I mean, he deserves to have, you know, some opportunities in life. He could get capped out if we continue on with this rhetoric, you know, and as we try to get disability Medicaid, get denied, appeal, wavered, all that nonsense. I mean, there are people out there whose care is just expensive. And when you have, you know, a young child with a disability or a young child facing cancer, I really view those lifetime caps as a real threat to them.
Sure.
Well, and I'd be interested in more information on these costs and where they come from and how they're developed. I recently had a procedure, and my hospital bill was $36,000 for one night, but the discount was $30,000.
Yeah.
So, what's going on where they can discount most of my care?
Transparency of the cost structure.
So what's happening with the costs that's the discount?
Yeah.
You know.
If people don't have insurance, they're completely screwed.
I think
So
that's the
it
next
makes-
I have a related concern about the cost. We buy EpiPens in our house. I have a son with a life-threatening food allergy, and also insulin. I have a son with type 1 diabetes. And the costs are completely unreasonable, as we all know. I mean, unaffordable. We're lucky. My husband's a doctor. We have pretty decent insurance. But there's so many who have to make horrible choices in order to get these, or go without EpiPens. And in this country, it was a bad deal when Bush did the Medicare Part D and did not allow the government to negotiate prices with the big pharmaceutical companies. And we're at a position where we're looking at other countries around the world who are not paying the cost that we are, and we need to push back and not be friends with the CEOs of the companies and look out for their interests, but look out for Americans, bring it to the table and say, we are going to negotiate as a country with you on these costs like everyone else does. They're getting a free ride here, and we're making horrible choices as families across the country as a result.
One thing about that, I'm a French teacher, and I spent a lot of time in France. And the biggest difference between pharmaceuticals in France and the U.S., and this is true in all of Europe, is there is no advertising. Why are we putting profits before people? Why is Big Pharma advertising, not just to us, to doctors, advertising huge ads on TV to get us to ask our doctor for this drug or that drug? On top of that, even over the counter. When I have been sick in France, I go to a pharmacy, and you remember the old generic packaging, white packaging like you see in a pharmacy? All of the over-the-counter things. You don't buy Midol or Advil, you buy ibuprofen. You talk to the pharmacist, you ask them, you tell them your symptoms, they say, oh, you could use ibuprofen. The pharmacist is able to give advice about over-the-counter medications and give them to you. You don't, go by your advertising and all this. All that advertising is, we are paying for that.
Right.
We are subsidizing that with the high cost that we're paying. And then they take those same drugs, they make a Meyer brand, a Walmart or Walgreen brand, and all of those. So you look like you have choices. But then they turn around and they go and sell those at cost to all of the other countries who have put their foot down and said, look, these are the drugs we need. We don't need all this bright packaging. We just need the drugs at a low cost, affordable cost that is affordable for everyone and is affordable for us. And that is how we could, if we wanted to, we could create a single payer system. Because a single payer system means that I think it's the only way to actually control the costs.
Right.
And you cannot have a market-based, advertising-based healthcare system because we are not the experts in what we need. We talk to our doctor says what procedures we need, our doctor says what medicines we need, and we're not the people that can say, oh, well, I guess I don't need that. Mr. Huizenga talked about his son's broken arm. Why are we putting that kind of a question in the parents? It should be the doctor. It should be that if I am worried about my son's broken arm, that I can go to the doctor, and if it's an emergency, I can go to an emergency room, and I can put my son's health first instead of my pocketbook.
And that's the thing too with HSAs. There is data out there, that
Right.
HSAs do lower cost, but part of that is because we reduce the health care we get. People stop going to the doctor because they're afraid they're going to find a lump or something serious that they just can't afford. I mean, we've already had to do that in our family. My son's care is so expensive that my health and my husband's health has to take a back seat. That I have to talk about, can I cut this pill in half? Can I, reduce my asthma medication?
And it's been shown that that is what people do. They're not just holding off on elective, expensive things. They're not getting their blood pressure medications. They're not getting their diabetes treated properly. They don't go get that physical that would reveal that they have an early stage breast cancer that'll be a lot cheaper to treat early than it will late. And then all of that ends up getting treated later at much higher cost. So there need to be some things that are easy access for people.
And I would say, I mentioned out in the hallway there that mental health care is a real concern to make sure that that's well covered. My husband makes a good income as a family doctor, and yet we have no money to put away for college at all for our kids. And we spent, in the recent years, over $20,000 on out-of-pocket health costs. We have good insurance, but it doesn't cover a lot of counseling. I've had a child with a social skills group that he needs, and all these things are very expensive. And I feel fortunate we've been able to pay for it. Well, we have to sacrifice. Do we want, we could have a great college fund and have them go off, but not be completely ill-equipped to go because they're not in a good place and they don't have the social skills or they haven't dealt with depression well as they should. Or we can take care of their mental health care, and then now they don't have this college, these college choices that they would have had otherwise. People are making hard decisions at all income levels, because of the high cost of healthcare and mental health care.
Sir, did you have something, or you able to speak
I
out there?
just wish we could, like you said, money just disappears, we have to pay this, we have to pay that, and I don't know, we can put it on government, but there probably could be some of these laws changed that would simplify it and change it, but part of it is our own fault, of somebody taking advantage of the situation. And this might be a little bit of a long story, but it's a very silly one. I was a guardian of a man that couldn't help himself, and he was on Medicare, and that himself was much more expensive if the doctor came to the hospital for the Medicaid than Medicare. And finally, he would go to the emergency room again and again. I told him he had to go to the doctor. Took him to the doctor passed him around to 4 different people, and finally he said, I felt pretty good until I went to the doctor, lost weight, I'll try to cut it short. Finally I said, why don't you try goat's milk? And he did, got better, and sometime later, I'd like to go to the doctor again. I said, why don't you try goat's milk? It isn't that bad. There's too many people like that. That's what's throwing up our bills.
Yeah.
I mean, generally, there are a lot of concerns, but I don't really see a willingness from the congressional Republicans in general, but from Representative Huizenga in particular, to compromise or to listen. Like, this is, really big deal. Like, you get the mama bear coming out in people when you talk about losing their health insurance. I mean, that's really messing around with our lives quite a bit, and I think we just deserve a voice and the opportunity to actually have input matter.
That's why I'm here.
That's what this is all about.
Sure,
The
absolutely.
listening, the considering all angles, communicating with us in terms of facts instead of rhetoric. There's a lot of rhetoric, it seems like, coming through, and it's not giving me information I can use to make my own decisions on what's going on. And I would like more details, more facts, more information, rather than just the party line.
Right.
Yeah, and another concern that we all had that we talked out in the reception area was to make sure that they don't repeal it without something to replace it, something that you're not going to pull the rug under, hundreds and thousands of people that are benefiting from the Affordable Care Act right now.
Sure.
And that
I don't think I caught your
Sue Schaub, I'm from Grand Rapids.
city on.
If I could say one thing, I don't know how much the congressman can look into it and whose duty it would be, but this overcharging, like she said, just, and then suddenly down, somebody has to look into that doesn't continue, because that is the bottom line of the cost that either we or the government pays for, and it is in our area, they're building hospitals, advertising, competing. And when we get the bill, it's terrible.
Especially if we're looking at caps, because does the cap include the $36,000 figure or the $6,000? That's big.
I think it's
If you have a cap in place, I think it's the six.
But there's one part of the Better Way plan that I think is a really great idea. Start it. Tort reform. Oh my gosh.
Yes.
Finally, we're nationally looking at tort reform. When I first started working in healthcare, it was a long time ago. I mean, I would meet physicians who were like, I pay $50,000 for my malpractice insurance here, but I would really love to go to Arizona and pay, 10.
Right.
I mean, it's significant, and it drives up our healthcare costs, and it gets into defensive medicine. And you see that, Michigan in particular is pretty poor OBGYN access in our rural areas and in the UP, which makes, to me, I'm really quite nervous about the Planned Parenthood Medicaid status. And let's not say defund it, we're just removing them as a Medicaid provider. But, it's already quite a big problem. And I don't want to see us go the way of Texas and have skyrocketing maternal mortality, that is my population that I've worked with, you know, for 7 years. It's women and their babies. And, you know, they already, many have to travel quite a ways, especially if they have any complications. But you see increased access with tort reforms, and I'm really excited that we're finally talking about it, and I would love to see that integrated into a big picture bill that is like a better for everyone.
The other thing that I would add is, if Representative Huizenga and all of these congressional Republicans are pro-life, why are they limiting access to contraception? And that was another part of the ACA. And contraception stops unwanted pregnancies. And if you want to lower abortion rates, that is what you need. You need universal access to good
Universal access.
well, yeah, universal coverage.
There we go.
Yeah,
Yeah.
universal
That's
coverage.
better.
You need affordable
Which is
family
really
planning,
what
which is what Planned Parenthood does.
Yeah.
I use
When they
Planned
say
Parenthood.
universal
When
access,
I
they're
was-
talking about you give a donation when you get your birth control pills from them, what you can afford.
Right.
So that is true access.
Right, it's a sliding scale,
Yeah.
income based. I used it when I was a young teacher. I used Planned Parenthood because I could get birth control affordably. And I don't know if anybody else has things to say about healthcare, but I didn't realize I was getting into healthcare.
Yeah, I didn't either. I got
But,
another issue too.
yeah, so
Yeah, and he has another issue
Yeah.
as well.
Sure.
I think let me just wrap up. I mean, I
You're
think,
right.
like, just to put it in a nutshell, healthcare should be a right for everybody, not just a right for people that can afford it. And repealing of the Affordable Care Act without a viable replacement in place that makes healthcare not just accessible, not just something that you can afford that you can get if you can afford it. It's something everybody should have. And repeal without replacement is reckless and inhumane.
And people who do that are going to have deaths on their conscience. And I would really appreciate it if you use those words for Representative Huizenga. Real people, real lives.
Here's another real life I'd like to show you.
Yes.
This is my friend Rana.
Okay.
She lives about 2 miles from my house in Whitehall.
Okay.
She became an American citizen this past summer.
Great.
She is married to a man in Whitehall, and they just had their baby daughter this fall. That's Karima, and her husband was just diagnosed with stage 4 terminal bone cancer. They have no family nearby. In order for her to stay at the hospital with her husband, she was had to send her 2-month-old daughter to live with her husband's sister-in-law in Cleveland. They are separated. This would not be the case if they